Associate Professor Kelvin and I'm an ear, nose and throat surgeon, or the formal word being otolaryngology and head neck surgeon. I was very lucky. I think early on in my career there was always an interest in doing health or some aspect of health. My mum's a nurse, so all the family would come to our house for ailments, suture removals, immunisations, cuts and bruises, and so my sisters and I used to sit there and try and help her out. And it wasn't until you get to high school that you start reflecting maturely and saying, well, hang on, why are they coming taking up our time? Why don't they just go to the hospital or doctor? And you realise that no one's actually getting access to healthcare, and that's the plight of that, which is quite devastating, because everyone else in my greater network of friends wouldn't be doing that. They say, why don't they go to the hospital? And then you start realising, saying, well, hang on, there is an inequality here. There is a paucity of healthcare services available to our mob, and so I always had that inspiration to get into healthcare. I think I was very lucky and fortunate to fall into ear, nose and throat. I've had lots of great mentors around me. Ear disease is one of the worst diseases in our community, and I think with all the chronic disease programs that we're talking about, we forget about hearing and learning. I think one of the things that I have a passion on is particularly looking at the access to healthcare services for all our patients. And I think in Newcastle, particularly ENT services, there is a paucity of access to ENT services across the whole community. And one of those obviously is making sure that our mob get looked after in that whole model, but it's about bringing the whole community together. And the funny thing about it is that the more effort and the more concentration we have on looking after our mob, and actually translate into great care amongst my non-Indigenous patients. So we talk about making sure there's ear health workers. There's the same thing, we call them clinical nurse consultants in this hospital. So it's a different kind of sphere of that, but the care and the model of care is ultimately the same, and that is making sure that every kid is hearing, that every kid is progressing in school, that every kid has that opportunity to make sure their life is fulfilled. And I think with all the chronic disease programs that we're talking about, we forget about hearing and learning. We have a very strong oral history, and if we're not listening and not hearing, then we're not learning our own culture and history. More importantly, if we're not going to school, we're not learning, therefore we're going to be behind all the time. So this is a really important area that I'm absolutely passionate about, that we need to make sure that we rectify that problem. And when you talk about ear disease in the Aboriginal population, our disease rates are worse than any other third world nation you're talking about across the world. And this is a first world nation with the healthcare parity that we see in the OECD nations, being second to Japan in our health outcomes, yet for our people, we're probably second from the bottom. The most important thing would be is make sure you look after yourself. Full stop. Any concerns ever, go see a doctor. Obviously from my perspective, get the hearing check, get the hearing check, get the hearing check. Don't have to worry about all the fancy stuff and know what's in and out. As long as the kids are hearing, they'll get through school and that's okay. If you have any concerns, talk to your health worker or your local doctor. Simple. So Little Mike, I love it, and it makes me smile when I see it. One of the things that's really hard to do in the medical profession is translate the work you're doing to the community level to make sure they understand. And obviously a big part of it, you heard from me before, is getting young kids involved in their healthcare and health awareness.
Well, listen up, cuz my words are tired. I'm a Delhi Curry kid named Little Mike. I'm gonna bring the news, I'm gonna bring it here. You're not hearing me, you better check your ears.
And Little Mike was dreamed up to try and make sure that we can engage them. So before they see me from an operation perspective, we can actually show them the video of Little Mike, which goes through a journey. The important part of Little Mike is that we had to make Little Mike cool so kids can relate to it. So I had to make it fun and easy to do. Then when you got someone like Little Mike, you can go through all kinds of health journeys, and obviously the ear journey is the one that we wanted to hone in on first. And so that Little Mike kids could relate to, they could enjoy, and put it in a fun environment to show that it's okay to go through this process. It's not shame, it's not painful, it's going to be a great process to get you back into life.
Listen up, cause Little Mike is here, and I'm talking loud and clear about checking on your ears, and don't live for another day. Listen up, if you got a bad cough or a snotty nose, keep your germs to yourself, nobody wants those. And when you're done with your dishes, put them in the bin. Wash your hands and everybody wins.
And so the underlying message from there was, what is that transition from going from having hearing loss through to getting an operation at the end of it? And that progress through that was beautiful. And the progress of that then is a message that also gets translated to the parents, because the parents often don't know, and we all know those who have kids. When your kid's going through kind of some heartaches, it's terrible not to know what's going on, so it gives them an idea what's going on. It is used so well that I've used it in my non-Indigenous patients so that they're aware of what's going on, because there's nothing around that really translates to that. Little Mike has been so successful that they've won awards for the cartoon, but also it's been used internationally. So colleagues in ENT that are all over the world, they're using this as an example of what we can do to engage the community. And what's really exciting for me is getting the feedback you see on social media, but also the feedback in the community of knowing what's going on there. Where I had one kid who was having an operation, and the other kid's going, don't worry, just look at the Little Mike video, you'll be cool about it all. And it really just put a level of calm amongst it all. And so I was really excited to see that. So I hope that we can develop this more, that we actually interact a lot more with Little Mike and ways of engaging our young ones to look after their own health.
Listen up, cause Little Mike is here, and I'm talking loud and clear about checking on your ears. And cause you see my hands and you seeing me spin, but you won't know a word if you can't hear a thing. I'm out.
I'm Dr. Kong, and I'm a Awabakal local legend.